Once clients come in, we try to get them to see a mental health provider, but as we know, there's a big stigma in relation to mental health. And we find that folks are resistant. And one of the things that we do try to do is just to encourage them to come in because it helps them with the process of getting housing, which is a major, major factor in providing stability so that folks can focus on their other concerns. We have folks that have comorbidities, they have diabetes, high blood pressure. To be homeless with those things is just compounding, and it just makes things so much worse. And so we like to try and have those needs addressed and get their mental health in a better place so that they can focus on being housed and just being better in society. And one of the great things about Care for the Homeless is that we do offer services in therapy as well as mental health. So that has been so amazing to be able to have a client come in and either see me for 35 minutes to an hour, or if I can't do it, we have providers on our team that I can refer them to so that they can get an appointment. That in itself is amazing for our patients. One of the biggest things that we constantly talk about is access to the services. And they have me available 2 days a week at each site. And once a case manager or the medical assistant or nurse says someone needs to be seen, we try to get them in there as soon as possible. This really works. At the Jerome Avenue Men's Shelter alone, we had about 110 residents that acquired housing because of Care for the Homeless. And between 52nd Street and Susan's Place, we housed about 150 women successfully, which is amazing. Being in your own space and being able to focus allows clients to be able to put their attention on the other needs that they have. They can get to their psychiatric appointments. They can go see that neurologist. They can go check the endocrinologist to make sure that things are going good because they have a shelter over there. They don't have to worry about those things. And Care for the Homeless does that for them. This is that first step for them. And we pretty much try to follow them throughout. One of the other good things is, as I could tell you about a little case that I had with one of our clients. Young girl, about 23 years old. She came in from out of state, had a little bit of family trauma. When she came in, she was speaking about 1 million words a minute. I could barely get a word in. She was really anxious, nervous, and feeling super depressed. I spoke with her and I set up another meeting with her for about 3 days later to see if she would come back in. She came back in, we talked some more, and she realized that she was having issues. Really smart girl. She was working and that sort of thing, but just couldn't focus, right? She had lived through this pandemic, not around anyone, and then reintroduced herself back into the work field and had issues. After we spoke a bit, she was pretty apprehensive, but she was able to agree to take some medication from me. And I saw her about 3 months later, and she was doing really well. She is now approved for housing and will be moving out in another 3 weeks or so. So we are doing good here.